Okay, we have Kaya here with her mom, Jez, and we're going to be talking about parasite prevention. So what that means is encompassing quite a few things here in Australia: fleas, ticks, heartworm, also intestinal worms. So the thing that we're going to focus on is tick prevention, because that one is the most deadly. So we have 3 different types of ticks in this area. The one that we're most concerned about is the paralysis tick. There's 2 other types, the bush tick and the brown dog tick. Still dangerous because they can carry infectious diseases themselves as well. So important to have good parasite prevention. So what that means with parasite prevention, there's a couple different options. You can do a yearly injection for flea and tick control. You can also do either monthly chews, or you can do topical spot-ons for dogs. There's some that are every 3 months or every 6 months. Just make sure that you always talk with your vet about which one you're using and making sure that you're using it appropriately. We would want to do a thorough check head to toe. Most of the time the ticks are going to be on the front part of the body above the shoulders. That's the part to really be thorough with. And when they are new, they can be harder to spot, but it's typically within 4 days that then we would be seeing the signs associated with a paralysis tick. And as they engorge with blood, they become easier to spot. Just running your hands over their whole coat, seeing if you feel any lumps, anything like that feel strange. Looking underneath their collar in any folds, so looking inside their ears, looking in and around their mouth, so like any folds around there, just feeling if you feel anything. Having a look at their eyes as well, if there's any redness, anything like that. Another place to also be looking for them would be between the toes. They just like to hide out in places that are harder to spot, in nice warm crevices. If you're unsure at all, again, just take your dog to the vet. We can always have a check and just see, is it a tick, and we can help you remove it if so. Worst case, if they were to get a paralysis tick, they can go off of their food. A classic sign would be that their bark might change. They might not be able to swallow food appropriately, might be hypersalivating. They might have a bit of a gag or a retch after eating. The reason that those things happen is because the toxins from the tick basically are causing paralysis in the body, so they lose their ability to swallow. Worst case scenario, then they are also then affected with their breathing. It is life-threatening, and if then their ability to breathe is compromised, then they can be needing to be on a ventilator. And a lot of the times, if it gets to that point, the chance of survival is not great. Now we'll talk about if we were to find a tick on Kaya. What you can do is there are little special tools that you can use to remove the ticks. If you don't have this at home, then you can either bring them to the vet, or you can use your fingertips to grab as close to the mouth as possible to try to pull them off. But basically you put it on the tick, and then you twist and then pull off. The toxins come from the body, so if the head were to get stuck in, they're likely safe, but we should still get that out. Other things with how to know what type of tick it is. If you're looking at it, or if you get a tick off, save it, bring it to your vet, so then we can help advise of which type of tick it is. But something that's helpful to know is the paralysis tick is they have brown legs at the front and at the back of their body. They have 8 legs. The 2 middle ones are white. So they're the only ones that have the different colored legs there.